This is Dr. Syeda Saba, Clinical Cardiologist at Onus Hospital. So my today's topic will be exercises for cardiac patient and how to approach them safely at gym settings. So a guided evidence-based exercise can transform the heart health when done right. Why exercise matters for healthy heart? Because it builds a stronger heart, a better circulation and a risk reduction, like it reduces the risk of blood pressure and cholesterol. How it improves your heart health? It improves cardiac output and its efficiency, and a better circulation is enhances for great oxygen delivery. Understanding cardiac conditions. So what type of patients will come at gym if they are having heart condition like coronary artery disease? Blocked arteries reduces blood flow to the heart. For this patient, how to manage at gym, which exercises are required, this is important. And it's a structural heart program is needed for every heart diseases. For heart failure we need an other program. For coronary artery diseases we need some other program. For arrhythmias means irregular heartbeat. And for post surgical recovery, what after post bypass or valve rehabilitation, what and how to structure a exercise program for those patients. Each condition requires a tailored approach. What is safe for one patient may be risky for another. Always work with your healthcare team to define your personal exercise boundaries. Your cardiologist is your best guide. Never self-prescribe exercise intensity. So how to evaluate a patient? Always first ask your gym member to first consult a doctor if he is having any heart disease. First consult a cardiologist or a physician. So how to approach a patient as a cardiologist? First, the cardiologist will ask the patient to get an ECG, 2D echo and a TMT done. Stress test is important as it calculates your targeted heart rate, so that from which you can calculate your safe zone, by at which heart rate the patient is good at gym, which is safe for him. More than that, it can causes him some symptoms like dizziness, chest pain or breathlessness. So I will explain you how to calculate the target heart rate slowly and how to achieve that in gym and how to maintain that level in a gym. After stress test, we have to give the medical clearance as a doctor. Then you have to follow that what doctor have prescribed as a heart rate at which the patient should work out in gym. So how risk stratification, and we will classify the risk determining the supervision needs. So types of exercises tailoring workouts to individual needs. First we start with these are the three type of exercises we actually start with. Aerobic exercises, walking, cycling, swimming builds cardiovascular endurance. Start with 10 to 15 minutes and 3 to 5 times per week. Then resistance training, that's for old individuals who are having knee issues and other joint issues. Light weights or resistant band improves muscle strength. Use low resistance with higher repetitions. Flexibility and balance. Yoga, stretching, Tai Chi reduces stress, improves mobility and supports overall recovery. So we have to follow these three exercises, 10 to 15 minutes, 3 to 5 times per week. Then slowly increase the pace and the time, like 10 to 15.
For 10 to 15 minutes, the minimum heart rate or maximum heart rate you have to do. For example, there are two types, low and high.
Yes.
So 3 to 5 times, how many per week, and high, how much per week?
First of all, let me explain you how to calculate a target heart rate for a particular patient of particular age. Suppose you got a gym member with age of 50 years and you want to calculate his target heart rate. What do you have to do? There is one formula, 220 minus the age. Suppose 220 minus 50 is 170. So the target heart rate for a cardiac patient in the gym should be 50 to 75%. 50% of 170 is 85. So 85 beats per minute and 75 is 120 around. 85 to 120 beats per minute is the safe zone for that patient. So we have to calculate like that. 50% of 220 minus 50 was 170. 50% of 120 to 75% of 120 is 85 beats per minute to 120 beats per minute. That is the safe zone you can play. Okay, then like that we have to increase the pace slowly. For first day, 10 to 15 minutes, play between 85 to 120 or something like that. Continue the same thing for 3 to 5 weeks. That will be beneficial for the patient, as or between that, like you can stop even with 100 heart rate or 110 heart rate, but never be beyond 120. Okay, if the patient suddenly have chest pain, breathlessness or dizziness, nausea sensation in female patients mostly, stop the program, ask them to rest and call an emergency service. So intensity and duration, finding your safe zone. First, the talk test. When the patient is working on a treadmill or some other equipment, you ask the gym member to just talk, converse while exercising. If the patient is gasping for breath, reduce the intensity immediately, or if he or she is complaining of chest pain, SOB, stop it immediately. Then target heart rate, as I gave you the example, 50 to 70% of target heart rate is a safe zone for cardiac patient in gym. Typically 50 to 70% of your maximum heart rate as determined by your doctor. Use a heart rate monitor for accuracy. Never push through the chest pain or extreme breathlessness. So this is the phases. First 10 minutes warm up. We have to slowly increase the heart rate. Then 30 minutes of main exercises in which the 50 to 70% of heart rate is going on. Like 85 beats per minute to 90 beats per minute, then 110 beats per minute, 115 beats per minute. Then cool down. Cool down is important and it should be for 10 minutes. Like the patient should not have sudden hypotension and pooling of blood in the extremities. Why warm up is important? To build the endurance. Suppose your patient is on the treadmill and he suddenly hold his hand to his chest. So you can ask him, do you have any chest pain or he is gasping for breaths, like that. So you have to stop the treadmill immediately, ask him to sit and lie down. Let me explain. Then again giddiness, and if you see any vein which is pulsating like that here, so we have to stop the procedure immediately. Okay. Sweating you can see, if he will be sweating on it, but with chest pain, that gives more. So how to monitor during exercise? Heart rate monitoring. Check pulse regularly. Stay within your prescribed target zone at all the times. Breathing rate. Breathing should be elevated but controlled. Sudden breathlessness is a warning sign. Obviously, the breathing will be elevated slowly on treadmill or cycling or even swimming. But it should not be sudden. Like I was normal just now, the patient say, I was not having ISM, breathless nahi tha, but फिर भी मेरे को एकदम suddenly आया. So you have to be cautious regarding that. Then body signals. Watch for dizziness. Dizziness is fainting. And nausea, unusual fatigue or chest discomfort. Stop immediately if these occurs. Exercise log. Record duration, intensity and how you felt. Share this with your healthcare team regularly. You have to record how the intensity of this patient is increasing or whether he is not able to do that. Then you have to discuss it with your healthcare provider. So what are the red flags and emergency things? Know the warning signs. Acting quickly can save a life. Stop immediately if you experience chest pain, pressure or chest tightness. Severe shortness of breath. Shortness of breath is ISM. Okay. Dizziness or fainting. Irregular raising heartbeat. Suddenly, sometimes the patient is on treadmill. The target heart rate is between 85 to 120. But suddenly it goes to 140, 170, it jumps to. So you have to stop the procedure immediately and ask the patient to lie down and call the emergency services. It can be anything. Extreme fatigue or nausea, and if he is extremely feeling very easily fatigability, only 10 minutes ke liye he is doing the treadmill, not as you prescribe 20 minutes or 30 minutes, then you have to ask him some questions. Aapko nahi aa raha kya karna? Are you not able to do it? What is the reason? You have to ask him and you have to discuss it with the healthcare provider. So emergency action plan. Stop all the activity, sit or lie down, call emergency services immediately, inform someone nearby of your condition or nearby hospital, take the member to the nearby, keep prescribed medication. Sometimes the doctor prescribed medications, like if the patient has active chest pain, they can keep one soluble tablet below the tongue so that the chest pain reduces. That is nitroglycerin. That's a life-saving drug sometimes. But not always. You have to definitely take the patient to the hospital. You should not just keep the tablet and send the patient back to home. Each stage should only begin after medical clearance. Patience and consistency yield the best long-term outcomes. For every stage, you have to discuss that with the healthcare provider. And the healthcare provider will guide you how to take the member further for load, like to increase the workout. Key takeaways and next step: get clearance first from your cardiologist. Stay in your safe zone, that is safe target heart rate. For example, I have given you 50 years of guy. The safe zone of heart rate is 85 to 120. Progress gradually. Increase duration and intensity slowly under medical guidance. Duration also you have to increase slowly over weeks, and intensity also slowly over weeks. Know the red flags. Stop immediately and seek help if warning signs appear. Thank you. It's all clear how to like calculate a heart rate, target zone for cardiac patients. This is in cardiac patients. Those who have underwent PTCAs or CABGs, heart failure patients, how to improve the heart health slowly, because physical activity is 100% important for everyone, not only for normal people. They should also get like active so that heart circulation improves and the heart endurance like improves. Thank you.